If you're over 75, the next 30 seconds could reveal whether you're at serious risk for a fall that changes everything. One simple chair test, no equipment, and what it shows about your body might shock you. Stay with me, because by the end of this video, you'll know exactly where you stand, and more importantly, what to do about it. Let me be direct. Falls are the leading cause of injury death in Americans over 75. More than 14,000 older adults die from falls every single year. But here's what most people don't understand. Falls don't just happen. Your body warns you months, sometimes years in advance. And this 30-second test picks up those warnings before you end up in an emergency room. I'm talking about the chair stand test, and it's been used by researchers and physical therapists for decades to predict fall risk with startling accuracy. What makes it so powerful? It measures the exact physical abilities that keep you upright and independent: leg strength, core stability, balance, and coordination. When those decline, your fall risk skyrockets. And most people have no idea it's happening until it's too late. On-screen text, 30-second chair test, fall risk predictor. Now, before we get into the test itself, I need you to understand what this is really measuring. Your legs are your foundation. Every time you stand up, walk to the bathroom, climb a step, or catch yourself from tripping, your leg muscles are working. Specifically, your quadriceps, the big muscles in the front of your thighs. These are your anti-fall muscles. After age 50, you lose about 1 to 2% of your muscle mass every single year if you're not actively working against it. By 75, if you've been sedentary, you might have lost 30% or more of the muscle you had in middle age. That loss shows up first in your legs. It shows up when standing from a chair gets harder, when you need to push off with your arms, when you feel unsteady on your feet. This test captures that decline in a number, and that number predicts how likely you are to fall in the next year. Studies have shown that seniors who score poorly on this test are up to 4 times more likely to experience a serious fall. That's not a small difference. That's the difference between staying in your home and losing your independence. Here's the second thing this test reveals: functional fitness. I'm not talking about running marathons. I'm talking about the strength you need to live your life. Getting off the toilet, getting out of bed, carrying groceries. If you can't stand up from a chair 10 times in 30 seconds, those daily activities are already harder than they should be, and they're about to get harder. So let's do this test right now. But first, a critical safety note. You need a sturdy chair that won't slide. No wheels, no arms if possible, but if your chair has arms, don't use them during the test. You need a firm, flat surface, not carpet. And if you've had a fall in the last 6 months, or if you feel dizzy or unsteady right now, do not do this test alone. Have someone with you, or better yet, do this with your physical therapist first. All right, here's exactly how to set this up. Find a hard chair, dining chair height, about 16 to 18 inches from the floor. Not a low couch, not a high stool. Standard chair height. Push it against a wall so it won't slide backward. Clear the space in front of you. Wear shoes with grip, or go barefoot if you're steady, but no slippery socks. On-screen text. Stable chair. Clear space. Timer ready. Sit all the way back in the chair. Your back should touch the backrest. Feet flat on the floor, about hip width apart. This is important. Cross your arms over your chest, hands on opposite shoulders. You will keep them there the entire test. No pushing off your thighs. No grabbing the chair. Arms stay crossed. Now, here's what you're going to do. When you start the timer, stand up fully until your legs are straight and you're upright. Then sit back down fully until your bottom touches the seat. That's 1 repetition. Stand up, sit down. Stand up, sit down. Keep going for 30 seconds. Count every full stand. We're counting the number of times you can go from sitting to standing in half a minute. A few common mistakes before you start. Don't lean forward with your upper body and rock yourself up. That's cheating, and it won't give you an accurate score. Don't stand up only halfway. Lock your knees, stand tall, then sit back down. Don't rush so fast that you lose control. Yes, we want speed, but we want safe speed. If you feel wobbly, slow down. And do not, under any circumstances, use your hands. The moment you push off with your hands, the test is over, and your score is however many you completed before that. Ready? Set your timer for 30 seconds. Take a breath and go. If you just did the test, welcome back. Write down your number. Now let's talk about what it means. On-screen text. Your score reveals your fall risk. For men over 75, here's the breakdown. If you completed 10 or fewer chair stands, your fall risk is significantly elevated. You're in the range where daily activities are likely already a struggle, and your likelihood of falling in the next year is high. If you scored between 11 and 14, you're in a moderate risk zone. You have functional strength, but there's room for improvement, and you're not out of the woods. If you scored 15 or more, excellent. You're in a lower risk category, and your leg strength is above average for your age. For women over 75, the numbers are slightly different because of natural differences in muscle mass. If you completed 9 or fewer, you're in the high-risk category. Between 10 and 13 is moderate risk, and 14 or more puts you in a lower-risk, stronger category. Now let me be very clear. This is not a diagnosis. This is a screening tool. It gives you information. A low score doesn't mean you're definitely going to fall. A high score doesn't mean you're invincible. But it does tell you where you are right now and whether you need to take action. If you scored in the high-risk range, don't panic. Panic doesn't help. Action helps. And the good news, the really good news, is that leg strength is one of the most trainable things at any age. I have seen 80-year-olds double their chair stand score in 3 months with consistent effort. It is not too late. So what do you do next? Let's get practical. On-screen text. 3 exercises to improve your score. First exercise, assisted chair stands. This is the same movement you just tested, but now we're doing it as strength training. Sit in your chair, feet flat, hip width apart. This time, you can lightly rest your fingertips on the armrests or the seat beside you for balance, but don't push. Stand up slowly, taking 2 to 3 seconds. Squeeze your thighs and glutes at the top, then sit back down slowly, taking 2 to 3 seconds. That slow lowering, the eccentric phase, is where you build the most strength. Do 8 to 10 repetitions, rest for 1 minute. Do another set of 8 to 10. Repeat for 3 sets total. Do this every other day. Not every day, because your muscles need recovery time, especially at 75 plus. As you get stronger over the next few weeks, use your hands less and less until you can do the full movement with your arms crossed, just like the test. Second exercise, sit to stand holds. Same chair, same setup. But this time, when you stand up, hold the standing position for 5 to 10 seconds. Feel your thighs working. Feel your core tighten, then sit back down slowly. This builds not just strength, but endurance in those leg muscles. Do 5 to 8 holds. Rest. Repeat for 2 sets. Add this into your routine 2 to 3 times per week. Third exercise, heel raises for balance. Stand behind your chair, holding the backrest lightly with both hands. Feet hip width apart. Slowly rise up onto your toes, lifting your heels as high as you can. Hold for 2 seconds, then lower back down with control. This strengthens your calves, improves your ankle stability, and directly reduces fall risk. Do 10 to 15 raises. Rest. Repeat for 2 to 3 sets. You can do this one every day if you want. It's low impact, bonus progression for all 3 exercises. As you get stronger, and you will get stronger, start adding small challenges. For chair stands, pause for 2 seconds at the bottom before you stand up again. That makes it harder. For the holds, let go of the chair for a second or 2 while you're standing. For heel raises, try doing them on 1 leg at a time, still holding the chair for safety. Here's the progression plan. Start with 3 sessions per week: Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. Whatever fits your life, do all 3 exercises in 1 session. It'll take you 15 to 20 minutes. That's it. No gym, no special equipment, just you, a chair, and consistency. After 4 weeks, retest yourself. Do the 30-second chair stand test again under the same conditions. Write down your new number. If it's gone up even by 2 or 3 reps, you're on the right track. If it hasn't changed, don't get discouraged. It might mean you need a bit more time, or you might need to check your form, or increase your effort during the exercises. At 8 weeks, test again. Most people see significant improvement by this point, and at 12 weeks, you should be noticeably stronger. Not just in the test, but in your daily life. Stairs are easier. Getting out of a car is easier. You feel more stable. On-screen text, consistency beats intensity at 75 plus. Now, I need to talk about red flags. These are signs that you need professional help before you start any exercise program, or signs that something is wrong during your test or training. Pay attention. If you felt dizzy or lightheaded during the test, stop. Do not push through dizziness. That's your body telling you something is wrong. It could be blood pressure, it could be dehydration, it could be a medication side effect. Talk to your doctor before you try again. If you felt chest pain, shortness of breath beyond normal exertion, or heart palpitations, stop immediately. That's not a fitness issue. That's a cardiac issue. Get evaluated. If you've fallen in the last 3 months, especially if you fell for no clear reason, you need a professional assessment. A physical therapist can do a full fall risk evaluation. Check your gait, your balance, your vision, your medications. Falls are often multifactorial. This test picks up leg strength, but it doesn't catch everything. If you scored in the high-risk range and you live alone, or if you have a history of fractures, osteoporosis, or balance disorders, I strongly recommend working with a physical therapist for at least the first month. They can design a program tailored to you, supervise your form, and progress you safely. Medicare covers physical therapy. Use it. If you have knee pain, hip pain, or back pain that gets worse when you do the exercises, don't ignore it. Pain is information. Modify the exercise, reduce the range of motion, or get evaluated. You should feel muscle fatigue, but you should not feel joint pain. And if you're on medications that affect balance, things like blood pressure meds, sedatives, or certain antidepressants, talk to your doctor. Sometimes a simple medication adjustment can reduce fall risk more than any exercise program. One more thing, environmental factors. I don't care how strong your legs are if your home is a trip hazard. Remove loose rugs. Add grab bars in the bathroom. Improve lighting, especially in hallways and stairs. Wear shoes with good grip. Keep clutter off the floor. Falls happen when weak legs meet a dangerous environment. Fix both. Let me bring this home. You just learned a test that predicts one of the biggest threats to your independence. You now have a number. And that number gives you power. Power to take action before a fall takes your life off course. This isn't about vanity. This isn't about being an athlete. This is about being able to get up in the middle of the night to use the bathroom without fear. This is about playing with your great-grandkids on the floor and getting back up. This is about not becoming a burden. And yes, I'm going to say it, this is about staying alive. Because a hip fracture at 75 has a mortality rate that terrifies me as a physician. But here's the hope. Leg strength is trainable. Balance is trainable. Fall risk is reducible. You are not a passenger in your own aging. You have agency, and it starts with 15 minutes, 3 times a week, and a chair. On-screen text. Retest in 4 weeks. Track your progress. So here's what I want you to do right now. First, comment below with your score. Just a number. Don't be embarrassed. This is a judgment-free zone. We're all in this together. Seeing other people's scores will motivate you, and it'll show you that you're not alone. Second, if you haven't done the test yet because you were waiting to finish the video, pause right now. Go do it. Then come back and watch the exercise section again. Third, commit to 4 weeks. Write it on your calendar. Set a phone reminder. Tell your spouse or your kids. Accountability matters. And finally, watch my next video on balance exercises for seniors over 75. Because leg strength is half the equation, balance is the other half. And I'm going to show you 3 simple drills that will make you dramatically more stable on your feet. That video is linked at the end of this one. Don't skip it. Remember, every single fall is preventable, not with luck, with preparation. And preparation starts with knowing where you stand. You've got your number. Now go do something about it.